So you start out by saying it's like the final frontier of bodywork, of health, of...
Well, certainly it's the next frontier of healthcare because a lot of people, I mean, everyone has a body who's walking the planet. Half of those people are women. Some large percentage of those women will have children, and even if they don't, they may have had multiple procedures since medicine is moving towards more interventions, not towards holism, but towards interventions. So those interventions could look like a colposcopy, getting some kind of tissue sample taken from the cervix if there's a suspicion of HPV. 40% of the women in the world have HPV, or test positive for it. That's a large number of women. So that's number one. Number two, people who've had birth interventions of episiotomy or C-section, vacuum extraction, forceps extraction,
tearing repair,
all of that. That's a whole another large proportion of the population.
Cyst removal.
Yes, ovarian cyst removal or uterine cyst removal or myomectomies where people are getting their fibroids removed.
That's right.
You know, many kinds of surgical. That too. Large numbers of hysterectomies or prolapse repair. That's another element that women, more and more as we have this aging population, women over the age of 70 they say that, I read in a paper the other day that there's no point in even describing it as prolapse because everybody has it over the age of 70, that's half of the world's population walking around with some kind of descent of their organs in their pelvis. So it's either the vagina, it's the bladder, or it's the rectum that are starting to lose their firm footing or their attachment into the pelvic cavity. Those repairs to replace or to support those organs end up creating scar tissue, which can then create numbness, pain, and sort of shutting down sexual function, or even interrupting urinary and fecal function. They have not a great reputation.